Imagine your child has a fever. You borrow money just to get into a clinic. The nurse suspects malaria, but doesn't have the tests to diagnose it or the medication to treat it. This is healthcare in Togo today, where 1 in 10 children die before their 5th birthday. It doesn't have to be this way. Since 2004, Hope Through Health has delivered high-quality health care to thousands of women and children living with HIV and AIDS in the underserved region of northern Togo.
Je suis Papou Deborah, âgée de 25 ans. Je suis membre de l'AED depuis janvier 2005. Le 11 janvier 2005, j'ai fait mon test et j'ai découvert que j'étais séropositive. Et je suis venue faire l'adhésion à l'AED. Là, j'étais bien accueillie. Je recevais des soins, des conseils. Je n'avais même pas pensé que je vais vivre jusqu'à ce temps-là, depuis 2005 jusqu'à ce temps. Aujourd'hui, j'ai fait 10 ans de vie avec le VIH. Et je remercie beaucoup AID. C'est une organisation qui est un peu exceptionnelle par rapport aux autres. Et avec mon travail d'agent de santé communautaire, au début, ça n'était pas facile. Mais maintenant, je me suis adaptée et je le fais très bien. Et par ça, je vis avec mon enfant aisément et j'ai l'espoir qu'avec ça, je vais réaliser beaucoup de choses pour l'enfant. Lorsqu'elle sera grande, elle ne va pas regretter d'être née d'une mère PVVH.
Hope Through Health builds health systems that ensure clinics have the supplies, equipment, and resources to provide high-quality health care. We deploy community health workers to deliver care to women and children in their homes. And we eliminate user fees so that everyone who needs care has access to it.
For the past 10 years, Hope Through Health has been providing healthcare services to thousands of people living with HIV/AIDS. Now, thanks to the support of Dining for Women, we'll be expanding to provide broader maternal and child health services to all moms and kids. Over the coming year, Hope Through Health will provide improved maternal and child healthcare services to nearly 30,000 people living in 4 underserved communities in northern Togo. To do this, Hope Through Health will train, recruit, and supervise 25 amazing women to serve as community health workers. These women, some of whom may have never had the opportunity to pursue a formal education, will serve their own communities as essential healthcare providers. Hope Through Health sees these women as a powerful, untapped resource.
So community health workers is like the replacement of clinical people in houses and in the community. Like normally people need to go to the health centers to get services, but community health workers are bringing services to them at home, and they always work in collaboration with the health centers always. There's a lot of people in villages, a lot of kids, they all don't have money or they don't have time to come to the health center. And the fact that the community health workers can go to them with all the medicines and just see very early that this kid is sick and tell the mom to go to hospital with the kids, that is something important that community health workers are doing. We made this recruitment process, we went to villages, we talked to chiefs and populations, and we made women propose themselves to be community health workers. So they just talk to communities, they talk to their population saying why they want to be community health workers, why they have like potential to give to serve the community. And then the community has this chance to ask them questions to be sure that they can do a great job. And we at the end interview them all and just choose the best ones. People think like women can do things in our villages, like they're not able to work on something really. So I think we choose women because we want to give them the opportunity to have to manage their own life. Using women to this job will be good for all the women in the community because they'll be trusting these women. They will never be trusting the men to tell the men their problem, their women problems and everything like that. So choosing women is like an advantage for us.
Access to healthcare shouldn't be determined by the latitude and longitude of one's birthplace. Poverty shouldn't be a barrier to proper health. Hope Through Health makes healthcare work for everyone. And when healthcare starts working, patients start to use it. Because every child will get sick, and every parent deserves a chance to make them better.
Si aujourd'hui j'ai pu atteindre 10 ans, j'ai l'espoir que j'aurai encore 10 ans, 20 ans, pourquoi pas 30 ans.